Dinamo-therapy using Skorpion dental optima. The movie is made under methodological guidance of Assistant Professor Maria Vasilova, Faculty of Dentistry, Sofia. Medicines can be implemented into hard teeth tissue and mouth mucus not only by application but as well as diadynamophoresis. Diadynamophoresis is a treatment method combining monopolar impulse current usage and medicines. Complex impact of these two factors, medicine's pharmacological activity and diadynamic current physical activity, is setting up the therapy's effect. The advantages of this method are medicine's depot creation into the harmed tissue and its retention, which is longer than in ordinary applications. D-phase, monophase diadynamic currents and short periods, which are well known more than 60 years, are used for stimulation. In cases of pain relieving, the used parameters are D-phase, monophase and short periods. The procedures are optimized in Faculty of Dentistry, Sofia. They are programmed within the device and are automatically executed. Diadynamic currents suppress pain, improve blood irrigation, oxidation processes and metabolism, and accelerate the resorption of pathological products. A modern schedule of gingivitis and periodontitis treatment is presented in the movie. The schedule can be applied together with medical treatment. After clinical oral hygiene, low-intensive laser therapy, diadynamophoresis of vitamin C, P, PP, galoscorbin or alloy. The patient suffers from cataragingivitis. Clinical oral hygiene and laser therapy have already been applied to the patient. Diadynamophoresis with vitamin C is executed on the third day. Personal electrode is prepared by sterilized lint wrapping. Vitamin C ampule is poured on the lint. If it is necessary, the buccal mucous tissue is isolated with polyethylene. The electrode is located in the area where the medicine will be inserted. In case of general gingivitis, the therapy is conducted several days. Each day, the medicine is inserted in different sectors. The hydrophilic pillow is moistened. The passive electrode is placed in it. The electrode is pressed to the patient's right hand. All metal jaws are removed. Intraoral electrode is connected to the red clips. A device for stimulating electrophoresis is selected from the complex. In case of therapy with vitamin C, a negative electrode is programmed with negative pole. Dentist takes two remote controllers. Attention is directed to the patient. Procedure starts. The button up is pressed permanently until the increasing current reaches patient's real base. After patient signs for shiver, the values are removed 1-2 levels by pressing button down. The patient is in peace till the end of the procedure. Device passes through one mode to another, cares for broken chains and for entirely proper way of the therapy. When procedure ends, device slightly gets out of its current mode, stops current, and the dentist switches off the patient of the current chain in reverse order. Three-four diadynamophoresis procedures should be made to the patient. In cases of initial caries and non-caries disease, fluorics or calcium ions are implemented in hard dental tissues in the same sequence but with other electrodes. In cases of non-caries diseases of hard dental tissues, enamel-insufficiency, erosio or abrasio, calcium ions diadynamophoresis is applied for suppressing the enamel hyperesthesion and solidifying its mineral net. For prevention and treatment of caries in the phase of white enamel spot, fluoretic and calcium ions are inserted for mineral net deficit compensation and for resistant fluorotide creation. Diadynamotherapy is applied successfully for treatment of stomatitis, alveolitis and periocoronaritis, neuritis of the trigeminal nerve, fractures, temporomandibular joint diseases, inflammatory processes of dental origin, and so on.